So in this video I'm going to talk about the acute kidney injury. Okay, I'll start with the definition of the acute kidney injury. Actually, in previous video I talked about the acute kidney injury, but it was from the pediatrics point of view. Now I'm going to talk about the acute kidney injury from the adults point of view, and actually they are very similar to each other. Okay, so the acute kidney injury definition is a rapid decline in the kidney functions. Okay, from the definition of from the name of the topic, it's acute kidney injury. The injury of the kidney will lead to rapid decline in the kidney function. It is rapid because it is an acute. Okay, we have another subject which is a chronic kidney injury, but here we talk about acute kidney injury. Okay, kidney injury is a decline in the kidney functions, and you all know that the main kidney function is to control the blood pressure and to excrete the byproducts of the body. Okay, so if we have a decline in the kidney function, we will have increase in that byproducts, and one of the most important byproducts is the serum creatinine level. So if we have a rapid decline in the kidney function, which will be manifested as an increase in the serum creatinine level, okay, so this is acute kidney injury. How much serum creatinine level should be increased, okay, to tell that this is, oh yeah, this is an acute kidney injury? The serum creatinine level should increase of relatively about more than 50%, and absolute increasement of 0.5 to 1 milligram per deciliter to tell that this is an acute kidney injury. Okay, sometimes though we have acute kidney injury, the creatinine may be normal, and this is actually in the first stages of acute kidney injury. Okay, in the acute stages of the acute kidney injury, because the creatinine takes time to accumulate. Okay, so sometimes we have normal creatinine, but still we have acute kidney injury. Okay, so this is the brief definition of the acute kidney injury. Now let's move to the more accurate definition, which is the rifle criteria, or the rifle definition of the acute kidney injury. Actually, we have a lot of definitions, but one of the most important used one is the rifle criteria. Rifle criteria is more about a classification or staging of the acute kidney injury. Each letter of this criteria symbols one word. Okay, so the R is for the risk of acute kidney injury, the I for the injury, okay, the F for the failure, the L for the is for the loss, and the E is for the end stage renal diseases. Okay, so here is the afferent artery of the kidney, here is the glomerulus, and here is the efferent artery, and after that will come the proximal tubules, the descending lobe of Henle, ascending, and of course the collecting tubules, and after that here is the toilet. Okay, sorry, here's the toilet. So the most important function of the kidney is to excrete the byproducts, just like what? Creatinine. Okay, so if we have an injury to this kidney, then we will have inability of the kidney to excrete creatinine and to get it out of the body. Okay, so we will have accumulation of serum creatinine. Okay, so the more the injury of the kidney, the more the creatinine we will have in the blood. Okay, because the more, if we have, for example, have 50% injury of the kidney, we have 50% reserved function of the kidney, so 50% of the creatinine approximately will be excreted. If we have 70% renal function impairment, okay, then we will have more creatine accumulation in the serum. So this is about the first thing to measure in rifle creatinine, in rifle criteria, the creatinine levels. Okay, the second thing, that when we have kidney injury, most of the times we will have decrease in the urine output, because the function of the kidney is to excrete the urine, and we have kidney failure, then the kidney is not able anymore to excrete urine, so we will have a decrease in the urine output. Okay, so each one of these stages, the risk, the injury, the failure, the loss, the end stage renal failure, is signified by some level of creatinine and level of urine output. Let's start with the risk for acute kidney injury. Okay, if we have an increasement of 1.5 folds of creatinine, okay, then we will have we tell that we have a risk for acute kidney injury. Okay, and if we have a urine output of about less than 0.5 mil per kg per hour for about 6 hours, then this is the risk of the acute kidney injury. Again, if we have a creatinine of more than 1.5 folds, urine output less than 0.5 for 6 hours, please focus on the 6 hours, because in the injury we have the same value 0.5, okay, but for 12 hours. In the failure the same value again, but for 24 hours. Okay, so again, this is the risk of acute kidney injury: creatinine 1.5, urine output less than 0.5 for 6 hours. Now the injury, the creatinine level should be more than 2 folds, okay, and the urine output should be less than 0.5 for 12 hours to tell that this is injury level of acute kidney injury. Okay, so creatinine 2 folds and urine output less than 0.5 for 12 hours. This is the injury. In the risk, creatinine 1.5, the urine output is less than 0.5 for 6 hours. The failure, creatinine is 3 folds, so please notice 1.5 folds, 2 folds, 3 folds in the failure stage, and the urine output again less than 0.5 ml per kg per hour for 24 hours here. Okay, so again, the creatinine, the urine output 1.5, 2 folds, 3 folds, the urine output less than 0.5, 6 hours, 12 hours, and 24 hours in the failure stage. Okay, now the loss and the end stage renal failures are not about the creatinine and urine output levels. They are about the time of losing the kidney function, the time of losing the kidney function to excrete creatinine and to make a urine output. Okay, so if we have a complete loss of kidney function of more than 4 weeks, then this is the loss stage of the referee criteria. If it is more than 3 months, then it is an end stage renal disease. So the chronic or the end stage renal disease for more than 3 months. Okay, the loss of the kidney function is more than 4 weeks. So this is the rifle criteria. I want you just to know that the acute kidney injury is not always oliguric. Okay, most of the times we have oliguric, decrease in the cardiac output kidney injury, or an anuric kidney injury, complete loss of the urine output. But sometimes we may have non-oliguric acute kidney injury. Okay, may sometimes be polyuric. Okay, so this is in severe cases of the acute kidney injury. So I talked about the definition of the acute kidney injury, the rifle criteria. Now I'm going to move to the causes of the acute kidney injury, and after the cause I'm going to move over the clinical presentation, the lab findings, the complications, and the treatment of the acute kidney injury. Okay, so let's start with the cause of the acute kidney injury in the subsequent video, in the part 2 of this series. Thank you very much for watching. See you in the next video.